Welcome, everyone, to the Four Eyes podcast brought to you by YoungOD Connect. We give you a clear view into the new grad or young optometry world across Canada and the US. And we are your hosts. I'm Dr. Amrit Bilku.
And I'm Dr. Deepan Kaur.
And today we are so excited. We are going to talk to the Instagram famous Dr. Christina Gratkowski. And she is not just an optometrist, but somebody who practices functional medicine. And I think this is luckily, it's a huge wave that's really coming on with all the newer generations, the younger generations of people. You see it all over social media, but honestly, I'm sure these conversations are being had at the doctor's office now, right? Like, what can I do naturally to change my lifestyle, change my habits, my diet, to improve whatever conditions I have? And so Deepan and I are obsessed with learning more about functional medicine, and that's why we have Dr. Christina here, because she knows all about it, and especially when it comes to dry eye, eczema, rosacea. So like that is really what we're excited to hear about, and just her journey into that. So welcome to the podcast. Would
Thank
you
you.
mind telling our listeners more about yourself and just how you got to this journey so far?
Yeah, so I'm an optometrist practicing in Virginia Beach. And my journey really started actually 11 years ago when I started CrossFit. So I've been CrossFitting for many, many years. So all my hobbies have always included fitness, nutrition, wellness, and naturally through CrossFit, trying to be a good athlete, you have to learn about nutrition. So that's what actually sparked me to first get my precision nutrition coaching certification. But I should add through all that time though, I'm just constantly listening to podcasts, reading books, doing all the things. I just love learning about nutrition. And then I also work for a nutrition company on the side. But I don't talk too much about that on my Instagram, so I help people kind of reset, learn how to eat, what to eat, which is pretty cool. And then through all of this, of course, you naturally start stumbling into functional medicine because it's so closely linked together. And for people listening who don't know, I mean, like you said, functional medicine is becoming way more popular. But for people who don't know, it's looking at the root of disease and illness and where things stem from. So, conventionally we were trained, okay, this is happening. This is going to be the diagnosis, and then here's the treatment. But functional medicine, we take that step back, and we look at everything else. And nutrition is, I say it's the base. So I always like to think of it like a pyramid, and nutrition is definitely the base. So that's how it all ties together. And then through in optometry, in practicing, I would just see so many connections to nutrition. And I would want to talk to my patients about it, but you only have 20 minutes sometimes, and sometimes not even that.
Yeah.
I
Oh,
try
yeah.
to take as much time as possible, but to talk to your patients about these things, and it was just really hard. So that's when I started taking the plunge and saying, okay, I'm gonna officially study so that I can actually do this outside of the optometry office.
Nice.
Okay. We've all been through obviously optometry school, and they don't talk about the root cause of anything really. It's
Mhm.
mainly about the diagnosis or the treatment, how to manage it. And then even Amarit was saying before, like functional medicine is pretty new in optometry now. You're always hearing it more from maybe your family doctor, other healthcare professionals like
Mhm.
nurses, maybe even pharmacists sometimes. But in your opinion, why do you think functional medicine should play an important role in practicing optometry? Because we just weren't taught to
Hmm.
Yeah.
think like that or to treat any of our patients like that.
Mhm.
Yeah, exactly. I think that in optometry, so many people think of the eyes as its own little organ,
Yeah.
and it blows my mind because the eyes are literally an extension of the brain. So
Yeah.
there's that.
Yep.
And everything that we are looking for, especially, in the back of the eye and the retina, it's all tied to the body. And for some reason, people just really they don't make that connection
Mhm.
with their eyes at all. But those were the connections that I was making. I mean, the biggest one I think for us is diabetes because we play such a big role in patient care. You know, we're doing diabetic eye exams, we're communicating our findings to their doctors. And how do you get diabetes? From, type 2, but because of your diet. So why
Yeah.
are we not talking to our patients about that? And
Yeah.
of course, you could have the basic conversations with people, but we're the ones who actually get to spend a lot of time. I think optometrists are a little lucky that even though we say 20 minutes isn't that much, but that's way more than 5 minutes with
Mhm.
primary care.
Yes.
So,
Oh, yeah.
I think that we absolutely are play a huge role. And then there's so many things too, like how many times do we hear how inflammation can show up in the eyes? And that's kind of my big thing
Yeah.
with functional medicine and optometry is that connection of, okay, well, where is the inflammation coming from?
Mhm.
And it's coming from, in the body, but also because
Yeah.
of nutrition. So just pretty much every connection. And that's what's kind of cool. Every disease somehow I can connect it back to the whole
Hmm.
body. I think there's a handful. I had somebody reach out to me recently for pigment dispersion syndrome, and I was like, okay, I got to dig a little
Yeah.
deeper on that one. So she kind of stumped me there, but for the most part, a lot of things you can tie back to functional medicine.
Yeah,
Mhm.
this is the same. It's funny because you know what? Shame on me. I'm still not remembering that there's like that gut eye health connection, right? For
Mhm.
me, I think that almost every single eye condition is connected to the brain and the spinal cord for like that autonomic nervous system. Like
Mhm.
for me,
Yep.
it's like whatever your prescription is, it's all related to your autonomic nervous system, your sympathetics, parasympathetics, the way your pupils are functioning. But it's that
Mhm.
similar concept, right? You're focusing more on that gut microbiome and like just what you're eating and nutrition and the function of your blood vessels connecting from other parts of the body to the eyes. It's so tough to like do functional medicine because I feel like these are all the things that we have to start paying attention to
Mhm.
in a 20-minute eye exam. And it's like we just
Mhm.
like where are we really going to find the time? We want to go into more of that inflammation and how you pick that up after,
Mhm.
but I think the question that I first just wanted to ask was, you know, how did you become certified in functional medicine or like what certifications or courses are there? I know personally that there's the Institute of
Mhm.
Functional Medicine and I've
Yep.
I've met other ODs who have taken courses through there, but like is there a guideline for what courses to take, where to start if you're interested in having this as part of your practice?
Yeah, so there's not, I wouldn't say there's a guideline because you're right there. I mean, there's actually a lot of courses out
Hmm.
there, which is kind of cool. So I did take coursework also through IFM or Institute of Functional Medicine, just because they're kind of, I feel, one of the kind of biggest names. They've been around for a long time. But through that, I've actually made connections with IFM trained practitioners who have then gone off on their own and have done some of their own
Got it.
certification programs. And I like some of those because they kind of take it to that, okay, how are we going to use this in everyday practice?
Yeah.
I like to think of IFM as kind of like an optometry school when you're sitting in the lecture part and they're just telling you all of the information, right?
Yeah.
And but you're not getting as much of the hands-on.
Yeah.
So thankfully, there are other programs out there that can kind of give you more case studies and hands-on. I'm also a restorative wellness practitioner, so there's that and that was an amazing course as well. They have like different courses.
Wow.
But there's actually a lot in there. And then there's also something called integrative care. And so there's also they don't say functional medicine per se, they say integrative, but there's also certifications in that, but it's similar. So
Okay.
there's a lot out there, honestly. And I feel like that's probably not the most straightforward answer, but that's kind of the cool part is you can find
Yeah.
programs that align with what you are looking for.
No, that actually
So,
helps because Deepon and I was just recently in Calgary for the Vision Therapy Canada conference. So hung out
mhm,
at Deepon's house after so many years. It was way too long. But we were talking about functional
Mhm.
medicine and just Deepon was asking like, yeah, like what, what course is the right course or like what is
Yeah.
the most comprehensive course or what's an actual certificate versus not. But I think that your answer actually helps everyone because that is a very similar journey to any OD who would want to get
Hmm.
into vision therapy.
Yeah.
There's
Yep.
no one course that tells you everything. There's probably like
Hmm.
5 or 6 different courses out there. They all overlap, they all intertwine, but then they all teach different things. So that actually helps because then
Hmm.
you don't feel anxious thinking, am I taking the right course? Like, am I missing something? Just take
Yep.
one, see how it is, let it guide you, and then figure out the next course if you have missing information or gaps in your practice that you want to fill.
100%. I feel like that's a perfect way to
Yeah.
describe it.
Are there
Yeah.
any courses that you're planning to take in the future, or are you kind of
Oh
like,
yeah.
this is
I'm
enough?
a I'm a forever learner. It's
Yeah.
good and bad. I love learning. I mean, there's a bunch that I am kind of looking at, but the problem is these, aren't cheap.
Yeah.
And
Yeah.
I still have, optometry school debt. That's a whole nother conversation. But
Yeah.
so,
Yeah.
so
Well,
That's another episode
we have
yeah,
completely.
optometry students and new grads listening. I mean, this is the long-term thinking, right? If
yeah.
you are a forever learner, yes, all of this education is expensive, but
Hmm.
you are educating yourself in something that no other OD in your area has. So
Hmm.
your eye exam is not going to be a 15-minute $100 exam or
Right.
$50. You know what I mean? Like you
Yep.
have those specialties now, you have those certifications. Your eye exam is going to be 45 minutes, an hour and a half, and your exam fee can go all the way to like, 300, 400, 500. That's the whole point of investing in yourself,
Hmm. Yes,
right?
that's so
Yeah.
true.
Yeah.
Yep.
So it is scary as a student to think, oh my gosh, like there's more I have to learn, there's more money I have to spend. You really do exponentially grow, in my
Hmm.
opinion, in the long run if you invest in those types of
Oh
courses
yes.
now. Oh, yeah.
Yep.
Exactly.
And when
And
you
you
love
can
it.
start your own side hustle, like
Yeah.
basically what you've done with
Hmm.
your own company, looking
Yep.
beyond health, right? So
Yep.
actually, perfect
Great
segue into
segue.
that.
Hmm.
Because I know, all our new grads or our optometry students that are listening, you do need multiple streams of income now to kind of survive in this economy.
Hmm.
Again, that's
Hmm.
another conversation.
Yep.
But yeah, can you tell us more about your company?
Yeah, so because of what I was struggling with and what we kind of already touched upon is how hard it is to cover all that you need to cover on an eye
Yes.
exam. That's what's really sparked me to start my company Looking Beyond Health. And it's a virtual practice, which is super cool because I can reach a lot more people. I can do it because I am still working, in the clinic. So I can reach people, I can work after hours, but it's one-on-one. Essentially, we call it like health consulting because I'm not using technically my optometry license for that.
Got it.
In the sense where my clients, they need to still see an eye doctor. So I'm not taking the place of their eye doctor. But what we do is really cool in the beginning. We do a very long health intake form. So very, we're taught how to take a health history, right, in optometry school, but this is kind of next level. So the form, I think mine's like 18 pages long, and
Wow.
it's even going back to when you were born,
Mhm.
were you breastfed, those kinds of conversations. So you're looking at every single thing that's happened to this person. And
Hmm.
then we do a case review, which is really 60 to 90 minutes. And we're deep diving the entire health history so I can get a good picture and I can take almost like a bird's eye view and connect the dots of what's going on now, but what may have occurred that caused the problem, or putting the links together. Because a lot of times some patients aren't thinking about, oh, my anxiety that I have and my gut, my bloating that I'm
Hmm.
having in my dry eyes. They don't even put those three things together and
Yeah.
they're all connected, with the gut kind of being the base for that. So in that, I kind of help them make those connections. And then from there, we enter into the program, which can be 4 to 6 months. So you're working with someone for a long time. We're getting their nutrition in check. We're looking at their sleep, their stress, as you mentioned, how much stress can affect everything,
Yeah.
and gut health. So pretty much almost every person has to do some gut healing. Really, that's like also the base. I guess I said nutrition's the base, but the gut is right there
Yeah.
with it. So we're doing all of that. And obviously you can see how you need just a lot more time and then to be able to do all of the healing and get everyone where they need to be. It is a long process. So of
Hmm.
course it's not a band-aid approach, but thankfully people who are reaching out to me understand that and they are looking for that kind of help and they don't want to just, take a medication to kind of get them there.
Yeah. And then speaking still amongst the side hustles, you released an ebook recently on healing eyelid eczema from a functional medicine approach. And this is huge because we see a lot in the industry and just in optometric care of, IPL, radio frequency,
Mhm.
all these other specialty dry eye treatments for eczema and rosacea on the lids. And you are really promoting that functional medicine approach. So, can you just give us a little tidbit about this ebook? Who is it meant for, ODs or clients and patients? And share some of the information that people can get out of this ebook and where all this information came from.
Yeah, yeah. So much. I have so much to say actually, but
Yeah.
hopefully I can keep it shorter. But so the ebook, I wrote it more for, I would say, the client and the patient. But of course, and an OD who's interested could get information from it as well. But something that was frustrating me was when I would see patients in my chair in the clinic that would come in with recurrent eczema. And again, I knew this link between the skin and the gut. And again, I've done it, but you know how many times we just prescribe, the steroid ointment,
Yeah.
and for some patients, it takes care of it. They're good, all is well. But then you have the people that are recurrent and they keep coming back, and or some it's so bad and your heart breaks because one of the reasons that eyelid eczema I think is I wanted to talk about it too is because I mean it's on your face, it's on your eyes. When people are looking
Mm,
at you, they're looking and talking
yeah.
to your eyes, so people can be very self-conscious about that. And it bothered me because I would talk to these patients and ask them about their working with their dermatologist, and they'd be like, "Oh yeah, they just gave me this ointment, and I'm gonna switch up my skincare." And I'm like, "But what about everything else? What about the inside?" I'm like,
Yeah.
do you want it to keep coming back or what? But
Yeah.
but again, my hands are tied in patient care because I just don't have time to go over everything. So I tried to make it a guide in case that someone maybe didn't want to commit, to full on working with me, just to kind of give people a place to start. So it goes into, what is functional medicine? How is it different than conventional care? And then we're looking at nutrition, of course. So there's not a ton about the nutrition, but I have a grocery shopping guide in there, which I call it
Wow.
the bonus at the end. But I'm like, I mean, that's kind of huge because it just is
Yeah.
for pretty much any inflammatory issue. I mean, it's going to be a similar guide, so it kind of has what people should or should not be eating. I talk about food sensitivities because that is a huge one as well.
Hmm.
In my business, my Looking Beyond Health, I will do food sensitivity testing, so we can really get very specific. But I would say for people if they're not there yet or they don't know where to start with that, I mean, big ones are going to be the gluten and the dairy.
Yeah.
And what's interesting is I actually am a fan of dairy. I'm not someone who's anti-dairy, but I think it has to be for the right person, and you have to know if you're having issues. But so with eczema, I say that's a good starting point is trying to eliminate gluten and dairy. Um, there's also, because the gut is so huge, so there's information about the gut, your immune system, 70 to 80% of your immune system is in your gut.
Hmm.
And so what I say to people when I think conventional care will talk a lot about eczema just being a reaction to something, right? How many times have we said, "Oh, well, did you change your laundry detergent?"
Yeah.
Yeah.
Um, and the patient's like, "No." And then you're like,
All
"Okay,
right.
well." How about
That's
gel
it.
nails? Get gel nails done, you
Yeah.
know?
Yeah. This is
Um,
like you talking about me right now. I'm like,
Yeah.
okay.
Literally.
Yeah, and before I really dove into it, it's just hard because you would ask all the questions they taught you to ask in optometry school, and then they'd be like, "No, nothing's changed." But so from a functional medicine lens, we're saying, well, why is your immune system overreacting to some of these common irritants or certain foods? Because even with food sensitivities, the goal shouldn't actually necessarily be to avoid certain foods forever. I
Hmm.
think that's where some misconceptions come in with food sensitivities too, is people will do some tests. That also is a whole nuanced conversation because there's different types of food sensitivity testing, but they'll do a test, they'll see that a whole bunch of foods pops up, they panic.
Yeah.
But really, what you need to be doing is actually healing the gut and then reintroducing foods back in. Um, so that's where, working one-on-one with someone helps. But if you're, again, just kind of looking at some of these pieces of the puzzle, you want to look at why is the immune system overreacting to these
Yeah.
things. Then, when your gut isn't working properly, you're not absorbing nutrients
Yeah.
correctly. So then you're looking at some nutrient deficiencies. So some big ones with the eyelid eczema are vitamin D, omega 3s, zinc. So those are some ones. So again, you by me saying this, someone could, of course, go out and just start supplementing with those things.
Yeah.
But really, we like to try to test, not guess.
Yeah.
You'll hear that a lot in
Yeah.
functional medicine to really find out, well, are you actually deficient in this? Can you actually benefit from these supplements? Sugar is huge. So
Hmm.
that processed foods and sugar. So we talk about that. But that's kind of there. I feel like I'm missing a few things, but that's kind of the big. I go into all
Yeah.
that. I think it's about like 50 pages. So I mean, it's a hefty ebook,
That's
but
great. Do you
yeah.
provide your patients like in your exam room, like a copy of the book? Do you recommend that they purchase it, or do you kind of give it to them as like a little like gift guide if they're unsure of doing other treatment options with you? Or are you just kind of like sliding it into like their purse, just kind of like go home,
Yeah,
read
I should.
this?
I should. I actually, the clinic that I'm in right now, I'm not really in the best place to be able to do some of those things. So who knows? I Some things may change, in the future.
Yeah.
But for now, it's a little tough for me to do some of that. But of course, naturally, these things come up, and sometimes I can't help myself, and I just start talking with patients, and
Yeah.
and they're like, "Well, how do I, work with you?" And I'm
You slide them a
yeah,
little
yeah.
card, like
I
you
may
didn't get
pass
this
the
for me.
card or
I
yeah,
mean, yeah, I
yeah,
don't think there's anything wrong with that. I'm just thinking of all the things you just said, and the
Yep.
conversation is very similar to what a lot of ODs do. And I feel like, again, in that 15 to 20-minute exam, when
hmm
you're trying to talk about everything else and you bring up these questions like, I don't know, did anything in your environment change? No.
Yep,
Okay, is your blood work normal?
Yeah.
Yes. And you're
yep.
like, and and I do ask about diet, but then people are like, well, I haven't changed that for the last like 5 years. I don't know. And you're like, well, I have no clue. So
Well,
we're
and
Okay.
going
it's
to
so
send you to the
specific, right?
dermatologist. Yeah, it's
It's
very
so
like
like if you
specific.
ask
Yeah.
them about their diet, like what are you eating every day? I mean, they're just gonna be like, I don't know, like a sandwich, a this, but then
hmm
we're not asking like, well, what's
Well,
in the
yeah,
sandwich? What
Yes.
sauce are
What
you
type
using?
of
I
bread are
know.
you using?
Yeah,
Yeah.
what bread,
But then that's the
everything.
part where you need another like hour to be with
Yeah.
Yeah.
this person, right? So
Yeah.
it is hard, but I feel like there's certain things that we can definitely, we can put or plant a seed in our
hmm
patient's
Hmm.
head and be like, there's a lot more to this
hmm
than just asking these simple
Yeah.
questions. So I'm glad, you have this ebook out so patients and even other ODs can kind of look at this and be like, okay, well,
Yeah.
what can I do to change how I
hmm
manage these
Yeah.
conditions? But also, Christina, another post I saw on your Instagram actually really got to me because I used to work at a dry eye clinic
hmm
and I did a lot of like radio frequency,
hmm
IPL, the lid wipes, the hot compresses, all this stuff. And I would always notice patients would be good for the first like maybe 6 weeks, but then they would come back for their follow up and be like, I'm not feeling that great anymore. I thought this would last a little bit longer. There's a post you made where you talked about how these kind of specialty dry eye treatments just treat the symptoms, but don't really
Mhm.
get to the root cause.
Yep.
And the root cause is basically inflammation. So, can you
Mhm.
talk more about that? Because I really think this is important for a lot of our new grad ODs and some of our practicing ones too right now.
Yeah.
Yeah, absolutely. And I also actually worked in a clinic that had a dry eye med spa. So it was awesome because I learned a lot about those things. And same
Hmm.
thing, I was more in the primary care side of it. So I wasn't
Hmm.
specifically myself working with them. But while I love all of those treatments, because I
Yeah.
think even, well, it's funny because I think eye doctors started saying, okay, well, that's, what's the root of dry eye? It's
Hmm.
the meibomian glands, the
Yes.
telangiectasia on there.
Yeah.
Yeah.
And so let's do IPL
Yeah.
and radio frequency to try to help with that. But to me, I'm like, okay, but what's the root of that? Why did
Yeah.
that
Yes.
happen?
Exactly.
Yes. Exactly. Like,
Um,
yes.
Yep, yep.
Yeah.
And because just like you said, that yes, you can, I mean, IPL really has been amazing and it still is amazing, but I
Hmm.
still think the missing piece is the diet, the nutrition, and the lifestyle. And that is where, unfortunately, it does get tricky though, because it's hard for people to be able to implement all of that. But I think that's where potentially having a referral network is
Hmm.
helpful because there's still that missing piece of the puzzle. I mean, I also think of how many patients do you see who come in and they just have like the kind of swollen eyes and
Hmm.
eyelids and they just look inflamed, right?
Yep.
Yeah.
And we're looking at, okay, well, what's going on with the eye? What's going on with, why do they have this edema where, and the answer is, they're what are they eating? What are they putting in their
Yeah.
mouth every day? And what is going on in their gut? Um,
Yeah.
and a lot of the times that's where inflammation comes from. So I think you guys probably would like to know, but there's a test called a GI map. I don't know if you've seen or
Oh,
heard of that. And so
no, not
that
really.
is the gut test that I use. There's other ones out there, but it's the one that I use. And what's cool is there's digestive markers and there's some inflammatory markers on that test as
Hmm.
well. So that's kind of what I utilize to see what's going on exactly in the gut. And then you can look at this and kind of get a bigger picture of where that's coming from. But besides working on gut healing, but then you also, again, have to get that anti-inflammatory diet in place as well, to try to calm down some of that systemic inflammation.
I love this conversation because this is what I talk to Deep on about in terms of myopia control.
Mhm.
It's the
Yep.
same, it's like there's so much information out there right now, just going like myopia is all about axial elongation. We got to stop axial elongation. And they look into the mechanism of axial elongation. And for vision therapy behavioral docs, we're like, yeah, but what triggered
Mhm.
axial elongation to
Yeah.
show up in the first place?
Yep.
There's
Yep.
other things going on that, yes,
Yeah.
we can use these myopia lenses and treatments and contacts, but again, it's masking what's really happening with the person, with the child,
Mhm.
their
Yep.
autonomic nervous system, everything. And so
Yes.
with dry eyes, yeah, and actually it never occurred to me about specialty dry eye treatments until Deepon brought it up to me about your post. And I was like, wow, I did not ask that question myself. Like, why
Hmm.
are the meibomian glands dysfunctional in the first place? I
Hmm.
also, was like, great, we found the cause for dry eye and we found the perfect treatments. And,
Yep.
every person who does an IPL or radio frequency is going to be cured and it's never going to come back.
Hmm.
Hmm.
And I feel so stupid thinking that now because yeah, it makes sense. Where did inflammation come from in the first place and
Yeah.
what's stopping it from showing up again just
Hmm.
because you reduced inflammation once around the lids?
Hmm.
Exactly.
Are you not going to get inflamed anywhere else ever again?
Hmm.
So
Exactly.
these
Yep.
are I love that you are really promoting functional medicine and how it intertwines with optometry on your Instagram page. You're doing a great job promoting it
Thank
on
you.
social media over the last few months. And I really hope that this conversation resonated well with any students or young ODs that are, you know, really interested in it or questioning what they've learned in school. I think this
Yeah.
Hmm.
this is how we are forever learners because we don't just graduate optometry school and say, okay, I'm done.
Hmm.
We graduate thinking, okay, why did I learn this? Why am I told to do it this way? Especially when it's not working for some patients, right?
Yeah.
Um,
Which happens a lot.
yeah,
Which happens a
Yep.
lot.
day one when you graduate, you're like,
Yeah.
okay, I'm just gonna give you this, 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 and then the
Yeah.
patients are like, nope, didn't help.
Yep.
And you're
No,
like,
Yep.
yeah.
oh, I
And I
don't
think
know.
that's why
Back
me and
in your
Amrit got
chair
into
again.
this. Yeah. And that's why we got into this kind of space because we were like, oh, yeah, remember in school when we learned this and to do this
Mhm.
treatment? Well, my patient came back a week later and said it didn't help. So what do you
What do
suggest?
we
And we're
do
just kind of
now?
like, what is going on? There has
Yeah.
to
Yep.
be something else. And I don't know, maybe I mean, Amrit and I graduated in 2019. When did you graduate,
Me
Christina?
too. Yep.
Oh,
Woo,
great.
we're the same.
So I don't know if like the students now are kind of
Yeah.
learning more about this area.
I hope so.
But I think it needs to be added
Yeah.
into the curriculum for sure.
Yeah,
Well, it's
I
it's
agree.
huge things. Even like I've always thought about just the way we were taught about AMD. The
Yeah.
the
Hmm.
minute we learn about AMD, the lectures just go about, recommend green leafy vegetables. And like
Yep.
that's it. And then
Yep.
every day in my clinic, I'm like, what am I supposed to say to these freaking patients? Like, go eat kale, spinach, like that doesn't apply to everyone, and it's not specific enough.
Yeah.
And
Correct.
it's just like myopia. Go spend 2 hours outdoors every day.
Yeah.
What? Why are you, how are
Yep.
we, that's not specific enough. Like, what do you mean? Just stand outside? Like, that doesn't change
Yep.
anything, right? We have to be more specific. And this is the hard part when we base our eye exams in 15 minutes, 20-minute
Mhm.
slots, just doing refraction and trying to get them out. We're never going to get to the root cause of anything because we're not looking beyond the
Yeah.
eyes.
Yep.
Yeah.
Yeah.
Yep. And that's really what inspired me because I was starting to I mean I've heard you guys talk about burnout before and that
Mhm.
is something that really I've struggled with because deep down I my real passion is all of this other stuff. And so
Mhm.
when I'm just and sitting there refracting and looking at the eye real quick and I'm like, oh, but there's so much more I want to do.
I
Yeah.
know. I totally agree there.
Yep.
I totally agree. But then you have like 30
Yep.
other people waiting for you, and you're
Yes.
like, well, here's some green leafy vegetables you need to
Yeah.
Yep.
eat. So you're
Yep.
like, good luck.
Yep.
Yeah.
And
Yeah.
it was painful for me and I finally
Yeah.
had enough. I'm like, nope, I gotta do something about it
Yeah.
because
Yeah.
it's so true.
Exactly.
And yeah, and I think that's a good point too, because when we say functional optometry too, because like I think I'm looking at it as the gut and all of those sorts of things, but there is the whole vision therapy side of it, which fun fact, I actually did an advanced studies in vision therapy, but then I ended up never
Oh,
uh I love it. So I will screen for it and then I will refer.
Yeah.
I ended up not following through with, getting it, but I 100% believe in it, obviously. And I think
Yeah.
that's a huge missing piece of the puzzle. So I love seeing all your stuff too, because
Yeah.
I'm like, yes, that piece is missing.
Mhm.
And that is another piece of functional optometry
Mhm.
as well.
Yeah.
So
Yeah.
mhm.
Do you have any final comments for or advice for students and new grads that might be interested in functional medicine and integrating it into their optometric practice?
yeah, so I would say just, keep learning. That's the biggest thing. And if you are a new grad and maybe you're looking and saying, okay, well, I don't know if financially right now, I can start taking any of these official programs. There are tons of resources out there. There's tons of podcasts. I mean, you can go on YouTube nowadays and,
Mhm.
just find
Yep.
things to just start learning and teaching yourself. And if you have a true passion for something, there's tons of free education out there
Yeah.
until you feel that maybe the time is right if you want to invest in yourself and in the future, kind of what we talked about before. But I mean, you can learn a lot, I think, and I think a lot of times people want that certification or is this person
Yeah.
certified in this? But you can learn so much and be knowledgeable about things. And yes, you can't just be saying whatever. So that's where the
Yeah.
certification helps. But you can really learn a lot,
Hmm.
even just without some of that. So just get on out there. And once you start looking, especially with social media, your algorithm will point you in the right direction.
Yeah.
Yeah, that's true.
That's true.
So
That
don't
is
pick
true.
the wrong person first, because then
Yes.
your
Yep.
algorithm's going to
Yeah.
send you down a rabbit hole, right?
Yeah.
Yep.
That's true. That's
Yeah, but I
true.
have
Yeah.
started thinking too, the one last thing, because these kinds of conversations, I do want to put out more resources. I started with the eczema eyelid book, but that's kind of in the works as well. I'm hoping to get some more courses and things out there
Nice.
too, just to make some of this stuff a little bit more attainable for people.
Yeah.
Nice.
Oh, I'd love that. I'd love like an OD specific course for just educating patients on nutrition and
Mhm.
diet, and just like the ebook, just giving them a guide to be like, okay, I'm not the professional to like help you with everything, but here's the checklist, here's the guide, and then let me know if you want more co-management.
Yeah.
That would be amazing. And
Yeah,
thank you again so much, Christina, for spending the time sharing all this on the podcast.
of
Um,
course.
We'll definitely share your social links and your information in the description for anyone who wants to reach out to you. We'll also share a direct link to purchase the ebook if anybody wants to download it themselves and then maybe share it with their patients or discuss it with their
Mhm.
patients. I think for anyone who's in a specialty dry eye space, this is definitely an
Mhm.
ebook that's going to benefit the way you
Yes.
practice and benefit your patients. So yeah, thank you again so much for
Thank
coming on.
you. It
And
was so
good
fun
luck.
talking.
Yeah, good luck with all your future resources. We're really looking forward to it.
Thank you. Yeah, hopefully I'll see you guys on Instagram.
Yeah. Thanks everyone for listening to Four Eyes, the podcast series brought to you by YoungOD Connect. Be sure to subscribe and follow us on Instagram or YouTube at Four Eyes Optom for more content. We'll see you next time. Bye.